Cardiovascular events in obstructive sleep apnea. Obstructive sleep apnea is a common disorder that has been associated with an increased risk of cardiovascular disease. Patients are often obese and have an increased prevalence of numerous other cardiovascular risks, including hypertension and type 2 diabetes mellitus, although is 2 to 4 times more common in men. Relationship of biomarkers or myocardial injury and incident heart failure in relation to obstructive sleep apnea appear to be stronger in women than in men.
Apnea syndrome, or OSAS, is a sleep disorder involving recurrent episodes of breathing or decrease in airflow for 10 seconds or more while sleeping. People with OSAS may also experience hypopnea, which is described to be episodes wherein the breathing becomes abnormally slow and shallow. OSAS arises due to an obstruction of the airways. Obstructive sleep apnea syndrome can be caused by
Application in medicine. Observational studies have demonstrated a consistent association between obstructive sleep apnea and hypertension, coronary heart disease, cardiac arrhythmia, and heart failure. Although most studies have demonstrated these associations independent of the confounding influence of obesity, whether obstructive sleep apnea lies directly along the causal pathway or is linked through common comorbidities such as obesity is not always clear in any given patient, and all these diseases carry multifactorial etiologic risk. Pro. In order to avoid the exacerbation of the disease, the doctors can recommend that the patients follow a healthy lifestyle in order to decrease the risk factors of obstructive sleep apnea and the cardiovascular events that happen during these episodes. Cons. In several cases, the patients do not follow the doctor's recommendation, and the correlation between overweight and obstructive sleep apnea is increasing in actuality. It's important to achieve a persistent conduct in order to control symptoms of the disease. Also, the continuous positive airway pressure (CPAP) have advantages and disadvantages of the therapy of this disease. Applied in Ecuador. In the present year, Ecuador have a lot of CPAP machines in several hospitals that provide the therapy of obstructive apnea disease. Continuous positive airway pressure (CPAP) therapy uses a machine to help a person who has the disease breathe more easily during the sleep. A CPAP machine increases air pressure in the throat so your airway does not collapse when you breathe in. Use the CPAP at home every night while you sleep.
sleep apnea is a common disorder.
Conclusion: individuals with severe sleep apnea are at increased risk of coronary artery disease, congestive heart failure, and stroke. The underlying mechanism explaining the association between obstructive sleep apnea and cardiovascular disease are not entirely delineated. Several intermediary mechanisms might be involved, including sustained sympathetic activation, intrathoracic pressure change, and oxidative stress.